in the heart of Yorkshire.
Red Ford. Hello, Barnsley A&E.
An unbeatable team.
1, 2, 3.
Hard at work 24 hours a day.
I feel like I'm on Titanic and bows just lifting up out at water.
7 days a week. Saving lives.
Hands across your chest, Mary. We've got you,
Helping loved ones.
Well, I'll be looking beautiful again.
Didn't expect to be losing part of my body today.
Making the community they serve better.
I thought I'd do it up.
Oh, you're okay.
All staff's been brilliant.
A health service treating anyone.
You'll need to see a doctor.
You'll find out that I'm an idiot.
And everyone. A team doing anything and everything for each other.
Sweetheart. Hey.
This is Barnsley Casualty 24/7.
The National Health Service might not be perfect, but thank God we've got it.
Another life saved.
On shift tonight,
Anthony, do you want to come back in, love?
emergency nurse practitioner Claire.
So I will now do another glamorous dressing for the third time today.
Oh, squirting.
Junior Dr. Josh Gemmell.
Duffy Joe's crossing all.
I'm sorry, sir. Is there any pain lower down?
And Sister Jane.
Unfortunately for ambulances, it is one in, one out, yeah.
So, park up and share a shift.
And the body came down.
While you were walking.
With the team at Barnsley Casualty.
Cheers, love, bye.
Barnsley A&E department.
The morning rush hour has begun in Barnsley Casualty.
I don't know how many ambulances I've got queuing.
Steering the department for this shift is Sister Jane, and top priority is to avoid an ambulance traffic jam.
I've got 1, 2, 3, 4, 5 ambulances queuing. 41 minutes is the longest wait. 14 patients waiting for beds on the ward.
Front of the queue is a patient with suspected multiple organ failure. At 97, Jim has managed to avoid hospital for most of his life.
I can remember when doctors wanted half a crown before they sell you.
Overseeing Jim's treatment is physician associate Adele.
What's been happening today then?
Well, I put everything down to one thing.
Okay, what's that?
Okay. This morning, the doctor phoned me up. He wanted me in hospital.
Yeah.
He was worried about my kidneys.
Okay.
First priority is getting a blood sample for analysis. Healthcare assistant Emma is tasked with the job.
I'm struggling, lad.
Do you think if I were to have a drink of orange juice or water?
I'll go get you a cup of tea. I think it is because he's dehydrated, so we've got a cannula in.
Yeah.
So he's got the veins, but there's just no flow coming out of it.
I'm sorry I'm causing you so much trouble.
Not a problem. Not your fault.
Dehydration is really common in elderly patients, so particularly in summertime as well, when it's much hotter. They might not have anybody in the house to get them a drink, especially if they've got poor mobility as well.
After Jim's had a tea break, time to try again to get that blood.
I still think we're going to struggle, Jim, to be honest.
Seems ironical. If you cut yourself, you'll bleed profusely.
Yes, you do, yeah.
And now...
Now we can't get it.
You can't get it.
So there are widespread implications to dehydration, some less serious, some more serious.
I don't know what they call it.
Success is what it is, thank goodness. I wouldn't have rested if I hadn't got your blood today.
It can sort of like dry out your kidneys, which can lead to an acute kidney injury. It just stops your body being able to function like it normally would do.
So them cups of tea worked, didn't they?
Yeah.
So hopefully that'll be enough for him, because I don't want to keep stabbing you. Right, we'll get that sent off to labs now and we'll see what's going on.
I always say the National Health Service might not be perfect, but thank God we've got it.
The results of the blood test will reveal if dehydration is causing Jim to have organ failure.
Hello, Barnsley A&E.
With ambulance admissions brisk today,
Yeah, okay, what have you got?
pressure is on the casualty team to treat all patients efficiently and effectively. And next inbound to resus is an 83-year-old with agonising abdominal pain.
Are you comfy there? Right, give us 2 secs. I'm just going to hear a little bit about you and then we'll get you sorted out, okay?
Dr. Gemmell gets a handover from the paramedic team.
Russell's got a pancreatic duct stone.
Right.
Just looked up about weight to 8 unit.
Okay.
Still suffering with severe abdominal pain, nausea, no vomiting.
Yep.
As a result, is not eating.
Yep.
Russell's wife, Christine, raised the alarm.
He started with pain again in his upper half and he's been in agony. So I rang the doctor and she said I needed ambulance. But it seems to have gone downhill. Is it best place?
Whenever a new patient's brought into our resus area, the things that we primarily focus on initially are people's airway, their breathing and their circulation. Have you been taking your insulins like you normally do?
Yes.
Yeah.
I've had a nurse come to show me how to do them.
Sure.
But I've only did them yesterday and I did him one today, but the nurse were there.
Sure. I suspect that you've just been started on the insulin, okay, to try and help with your blood sugars. Because you haven't been managing to get any food down because of the... not as much as he normally would, yeah. So you haven't been taking as much sugar in. Russell's got pancreatic insufficiency. He's also had a stone in one of his pancreatic ducts. Now, both of these things would predispose people to having some inflammation around the pancreas called pancreatitis, which can be really unpleasant. I think once we've got a cannula in for you, okay, as well as we might need to give you a little bit of sugar, but shall we give you a bit of morphine? That might help with the pain. Shut up, Scratcher.
This is different job, Scratcher, no.
A cannula can also be used to take blood samples.
If I have a very gentle press on you, that's very sore. Okay, I'm sorry, sir. Is there any pain lower down? That's okay.
Just a bit.
If you get infection within your abdominal cavity, it's liable to spread and people can become very septic and do die when that happens. I don't think you're in a fit state to be going anywhere today, are you really?
Russell's condition is serious. The team need to decide on treatment fast. Traffic through Barnsley Casualty has been busy since Sister Jane's shift started.
There's about 12 waiting for AMU. There are no beds, there's no movement. The porters have just been down to say they've got very little movement for AMU. For the ambulances parked outside the hospital, the impact on the community is huge.
While the ambulances queue, patient care is provided by paramedics like Shay.
Until the patients are cleared from the A&E, no further ambulance crews can get in at this moment in time. We've had to wait about 45 minutes with our patient to hand over.
The impact that it has on the nurses when ambulances are queuing up is frustration, because they want to get the patients out as quick as possible into another cubicle ready to be seen by the doctor. Unfortunately for ambulances, it is one in, one out, yeah. And it's equally as frustrating for the ambulance crews because they need to be back out on the road answering the 999 calls.
There are plenty of walk-in patients too today. Anthony has been rushed in by his partner Lisa following an accident demolishing a bathroom. A shard of porcelain has sliced open his leg.
Well, like a spear, pulled it out and it just started squirting blood everywhere.
Auntie!
Emergency nurse practitioner Claire will be treating him today, and it's a case of déjà vu.
Hello! Have I seen you before?
Yeah, last week.
What did I... Oh, heck! Oh, my goodness! Have a seat. So what's happened today?
I've been gutting an house, a bathroom, and I've been on my hands and knees and I've hit a pedestal to smash it up with lump ham and a big chunk's just dropped on my leg.
Okay.
It's like I can't bend it now. A ligament or something came out, and then when I stretched my leg, something popped back in.
It's really swollen, isn't it? What inspired me to be a nurse was watching television programmes myself as a child. When I started my nurse training, I always wanted to work in accident and emergency. And when I qualified, I was lucky enough to be taken on as the only newly qualified that they'd take here at Barnsley. Can you lift your leg off the bed straight up?
No.
Not at all? Sorry. Just take this sock off. Tightest socks in the world today. Right, I'm just going to give it a clean up and put a dressing over it. So it might be just that it's really swollen and there's a big blood clot there that's painful, or it could be that you've nicked into that area. And apart from this blood here, did it bleed a lot otherwise?
As soon as I did it, it started squirting everywhere, on walls and that.
Alright.
And then as I stood up, it was just pouring out. It was like I could see things, moving around
Within
inside.
it, yeah. I'm not going to go probing around too much, because if we start it bleeding again, then we might get it on our walls.
Anthony is sent straight to X-ray to see if there's any porcelain in the wound.
Have a lay down for me. Straight up, that's it, and then flatten down.
I'm just looking at the X-ray now. Where the wound is, there are a couple of dense areas that could be foreign bodies.
A wound like this has a high risk of bacterial infection. Anthony's injury will require further investigation. The ambulances keep arriving, and in recess, Dr. Gemmell is investigating the cause of his patient's chronic abdominal pain.
From this morning he's been in agony.
Russell has suspected pancreatitis, but after recently starting insulin for his diabetes, there are a lot of factors to consider.
Now, artificial insulin is great. It'll help regulate your blood sugars, but you're not able to get any sugar in, eating and drinking, because, say, you're vomiting all the time, and that's going to start lowering your blood sugar.
With a cannula in place, tests and treatment can begin.
I'll start off with this pain relief now. I'll give you a little bit to start with.
Brilliant.
Any of that helped settle your pain down at all, sir? Your pain's feeling a bit better?
Yeah.
Okay, good. What's your pain out of 10 at the moment?
About 6 or 7.
About 6 or 7. Okay. The colour's returning to you a little bit.
Yeah.
As long as we can keep people stable and stabilise them, then we've got time to dig into what's causing their problem and to get them sorted a little bit further down the line.
He looks a lot better now than he did when he came in. He feels a bit better, don't you? This is Finn. And he was sat at side of you all the time, weren't he? While ambulance men were there.
Oh, yeah.
He wouldn't leave you. He don't go far from his dad. But he's as good as gold.
Russell will have to wait for the blood test results to confirm if he'll be home with his dog Finn anytime soon.
Good morning, my cherubs. Are we all right?
Patients are moving through the department, and volunteer Jane is on hand to swiftly turn around the treatment bay beds.
So this cubicle is now finished with. I'll get it sort of tidied out, ready for next unsuspecting person.
And with ambulances still queuing outside, things aren't empty around here for long.
I need to go get shut of these.
Are they used?
Yes, unfortunately, yes.
Paramedic Shay has handed over his patient and is grabbing a quick brew.
Have a coffee and cake.
Right, I'll go in there now that this come out, you see. This, you know, this kitchen...
This kitchen ain't big enough
no.
for the both of us.
What? No, that... Oh, sang that sparks.
In fact, the whole department is bursting at the seams.
92 in the department and 13 waiting for bed still.
And now, hospital security has spotted another new patient in the car park.
I've just found Donald wandering around in the hospital and obviously noticed laceration on his head, and it were a bit disorientated, weren't you? And he'd
Yes,
been
a
looking
bit.
for his wife who was on AMU. So it's more worried that he were going to get a telling off his wife for being late for visiting.
And my wife is unimpressed. Not with the hospital, with me.
At least 82-year-old Donald is in the right place for his injury. He's left in the capable hands of Sister Harriet.
Can I check your blood pressure, please? I'm one of the nurses.
You can, yeah.
I love working in Barnsley, just mainly because of the Barnsley folk. They're really friendly and chatty, typically, and tough as well.
Right, just lift this sleeve up. And have you got any medical history?
Yes. Oh, yes.
What medical history have you got?
Well, I've had surgery at the Hallamshire. I've had a brain tumour. I'm trying to think what else. There's that many things. I've fallen off my motorbike more than once.
And what's happened today? What's brought you in?
Well, I've come to see my wife.
And what happened?
A car was going through and the barrier was up, and I followed the car, but I was looking at the car, and the barrier came down.
While you were walking? Oh, bless you. What happened? Are you okay? What happened?
Well, I didn't fall down. I just carried on walking, and then after a while, I felt liquid. And of course, it was running down my face.
Oh, bless you.
No, I don't deserve a blessing for this. No.
Have a little look.
Was it gone that far down? Oh my goodness.
Well, it's muck.
I love being a nurse. I've always looked after my grandparents and my brother growing up, so that now I can do that as a profession as well. I really enjoy it.
Spent about an hour getting shaved because she was very critical of it.
Your wife were?
Oh yeah, if she don't like something, that's it. You've got
Really?
to change your ways.
There we go. That looks loads better. Yeah, it looked really dramatic with all that
Well-
blood.
My mum's a nurse, my grandma was a midwife, so I guess nursing's just in my blood. I couldn't really imagine doing anything else.
Yeah, you'll need to see a doctor.
Oh my gosh, he'll find out that I'm an idiot.
And then if doctor's happy, we can get you back up to see your wife.
Donald will need to wait to get the all clear, so the delay to visit his wife on the ward continues.
If you need anything, just let us know.
And delays are the last thing Sister Jane needs too.
Jane was struggling for space around the other day.
What do you want me to do it?
Oh, I
about
thought
it?
that's wrong with us.
Build another department.
In Rhesus at least, Russell's abdominal pain is under control.
Your blood tests are back, sir. Okay. Your markers of inflammation are up a little bit, so I strongly suspect that it's going to be your pancreas. He's going to require hospital admission because he's had a very low blood sugar. He's going to require a bit of a review from the diabetic team because he's in a lot of pain with his pancreas.
I'm taking him and then I'm going home to see my little dog.
We might be able to bring him down from our Rhesus area back into the main department, free up a bit more space in our high dependency area in case more particularly unwell people come in.
And I'm going to get my head down.
Nothing much more to do from our point of view. Another life saved.
Russell had to stay in hospital for 2 weeks to be treated for an infection in his pancreas. He's now back at home and enjoying time with his dog Finn. In cubicle 3 though, 97-year-old Jim has suspected multiple organ failure.
I've got a bit of a rumble in my ticker.
Physician associate Adele suspects chronic dehydration is responsible.
I'm going to have a listen at your lungs then, OK? Just take a deep breath in for me. You can sit back now for me.
Thank you.
Can I just have a look at your legs?
You'll find the best veins in Barnsley.
Are they normally this swollen?
Yeah.
You've had previous blood clots in your legs though, haven't you?
That's why they put me on warfarin.
I think you might have some signs of heart failure. When you've got heart failure, the heart can't pump the blood as well, so it's not pushing the blood and the fluid into all the right places, and because of different pressures in the body, it means that the fluid goes into the easy opening spaces. You've got some fluid collecting in your legs, possibly some at the bottom of your lungs as well. I think it's worth getting a chest x-ray, and I think it's worth you staying in tonight with us.
I don't think we're going to be able to fix it in A&E. I think he needs to come in, have some fluids, have some further investigations done that we can't just do in A&E.
Jim's care is handed over to Junior Dr. Dylan Vyas.
97-year-old male. Yep. I'm going to get an ECG, I'm going to admit him to medics, going to get a chest x-ray and just check the ECG. One of the other doctors is going to take over your care now, so it'll just be a case of waiting for those tests to be done and then you can go up to the ward, OK?
Thank you.
Any questions for me?
What time do we have tea?
Next stop for Jim is X-ray, to see just how much fluid he has on his lungs. If left untreated, it could be life-threatening. Barnsley Casualty has been swamped with ambulances all morning. But Sister Benita has arrived in the hub to give Sister Jane some support.
I've come to help. Yeah, but you didn't start till 11, love. It's been like that since 9.
It's been a tough start to the shift for everyone.
We've been queuing all day, love, since 9 o'clock this morning. And then I lost the plot, didn't I? I lost the plot with people because nobody were helping me.
Donald is coming back from radiology. He suffered a nasty head injury in the car park while on his way to visit his wife in the hospital.
Oh, who were you on phone to then?
My daughter.
Oh, she's making sure you're okay.
Mum's rung her.
Advanced clinical practitioner Chantel needs to assess him.
All right, well, let's try and get you sorted so we can get you up to your wife, and then you've got a story to tell her then, haven't you?
Yes.
You might cheer her up a little bit. Let's have a look at your head.
I like a patient with a sense of humour. It also depends on my mood. If I'm in a mood to talk. Yeah, I like a chatty patient.
Okay, you sit forward for me.
To ensure Donald doesn't have concussion, a series of tests are carried out.
Yeah.
Yeah. Squeeze my hands nice and tight. Squeeze them. Nice and tight. And can you feel me touching you, okay?
Mm-hmm.
Good. Right, let's have a look at your head. Then we'll see what damage you've done, if any at all.
See, I've done things in my life, but nothing like this. I've fallen off my motorbikes plenty of time.
I think the older generation can be quite fascinating because when you delve into their stories, you find out actually the things they've been up to when they were younger, and that can be quite fascinating.
You seem a bit of a rebel anyway, so I think
well,
it's in your nature to have just walked under it.
In my late teens and early 20s.
I'm not a good rule keeper.
What, yeah?
No, I'm a bit of a rule breaker, me. You've got a relative in reception waiting for you.
Oh, my daughter.
There you go.
Oh, yeah.
So on that note...
French.
Right, well, you better go so you're not in bother.
She's more talented than her dad.
You sure? Clearly.
But she don't talk as much as her dad.
She don't walk under barriers, does she?
No. So I can go back, can I?
You can go.
Right, I will say goodbye.
Goodbye. Goodbye.
See you later.
Today's close encounter with the barrier has at least had a silver lining. Donald got to see his daughter too, and his head wound needed no further treatment. Ambulances are still queuing outside, so emergency nurse practitioner Claire is doing her bit to get patients through the department.
Anthony, do you want to come back in, love?
An X-ray has revealed that one of her patients, local builder Anthony, may have contamination in his leg wound.
There's not anything clear on there of anything that's a foreign body. Yeah. However, there are a few little areas that are suggestive of something. These wounds have been caused by trauma, so there's always a dirty element to those wounds that we see. They've been caused by some external impact that's caused the wound. So therefore, we need to make sure that we're going to reduce the risk of infection. Now, I need to have a sort of a clean around of it and see how deep it is. When did you last have your tetanus?
I don't know, I don't really have them, to be honest.
More than 10 years ago. Yeah, so I gave you a tetanus as well, okay? It's a deep wound that's not been cleaned surgically in a short space of time, so we give a booster, to be perfectly honest, to be on the safe side that it's not going to develop anything. That's just in case it squirts on me. I got caught short the other day by somebody that squirted out on me. That's just his leg hairs.
Trying to keep a brave face.
Men are always the best patients at hospital, you know. It's when they get home. Just measure how deep it is. Bag on 3 centimetres deep.
Oh, it's squirting.
I think you've just nicked a vein, to be honest, you know, and that's why it squirted out.
Anthony needs to be back on his feet as quickly as possible so he can get back to the building site.
Hello, can I refer you a patient? And he's got a wound to his right distal thigh, medial to his quadricep tendon. Okay, thanks a lot. Bye-bye.
He's given a tetanus booster, which should keep him protected from future infections for the next 10 years.
Top of your arm, my love. Oh, where shall I get in this tattoo? There you are.
Now, Anthony just has to wait for his consultation with the orthopaedics team.
Good morning.
In ambulance admissions, paramedic Shay has just triaged his 6th patient of the day.
I'm not.
Jason,
hey, sweetheart. Hey, I tell you what, I went to Mallorca and I was thinking about having a go at that Love Island.
Me and you together in Love Island?
Me and you together in Love Island.
By the pool?
Yes. I'm not sure that my buttocks are quite as juicy and firm as what they are on that programme.
I think they'd roll me into the pool. The tidal wave would come, wouldn't it?
Jim, who is chronically dehydrated, is on his way to radiology. He's at risk of organ failure.
So, come give this a hug for me.
Me on me, front or back?
Front.
Front.
Just mind your nose.
It's a big one.
All the better to smell with, eh?
He's getting an X-ray to check the extent of fluid detected on his lungs, a sign of heart failure.
Right, James, breathe in. Hold your breath. Breathe normally.
Back in the hub, Dr. Vyas reviews the results.
So the chest X-ray just looks like worsening heart failure. His heart looks pretty big as well, which all fits with heart failure in this patient, which fits with blood. He's got a kidney injury. But we've got to be careful with these sort of patients that we don't start overloading them with fluid, because then that can exacerbate the heart failure. Well, they'll have treated you to some nice NHS sandwiches then, have they?
At 97 years of age, I'm not going to be going uphill, I'm going to be going down.
Oh, well, we need to make sure you don't go further down the hill.
Yeah, every day is a blessing.
Well, you're a centurion, you need to get to 100.
Well,
you're nearly there, aren't you? I'd be lucky to get to your age. Your heart's struggling a bit, and that's why the fluid in your heart is backtracking into your lungs. I'm going to chat to the consultant to see if we need to get worried about these heart changes. But if they're happy, then we'd be happy to send you up to the ward and treat you as heart failure and try and get this fluid off your lungs. Boris, can I run this ECG past you? He's the one with heart failure and AKI.
It's agreed Jim should be admitted for treatment, so it looks like more hospital food until tomorrow.
I've said many a time, National Service, not perfect. Thank God we've got it.
Enjoy the hospitality.
OK, thanks.
See you later.
Jim was sent to the ward for further tests while his lungs cleared. He was then discharged with a care package to help him at home. It's not just elderly people who are being rushed in by ambulance. Paramedics have brought into paediatrics a 4-year-old struggling to breathe.
So, George, around 7 o'clock this morning, his mum's noticed that we're having some difficulty breathing while we're asleep.
Mum Charlotte is with George.
His cough that bad today was every time he gets a cold, it goes straight to his chest, and he just... You've not been this bad though, have you, kid?
Difficulty breathing can be extremely distressing, especially when you're 4 like George. So Nurse Alicia is straight on the case.
Put this on your finger. Is that from eczema?
Yeah. Oh, he's got the lot. He's got asthma and hay fever.
So his oxygen levels are where we want them to be. Still in a little bit of one, but I'm not allowed to diagnose, which is so I can hear it. I'll go get an inhaler out there. We'll give him 10 puffs, and then after that we're going to get one of the doctors to have a proper listen, and then take it from there. Is that alright?
Yeah. His doctor's going to look after you. Make you better. Oh dear. My daddy'll be here soon.
So we are going to do 10 breaths, okay? Are we ready? Can you count with me?
Yeah.
Ready? Ready. 1, 2.
The nebulizer will relax the muscles of the airways into the lungs, which makes it easier to breathe.
Just give him 10 minutes. I'm going to pop back in with one of the doctors to have a listen.
Low oxygen levels in George's blood are the main concern for the medical team, but the inhaler seems to be improving his breathing.
It's got a lot better than what it was, but there's still a little bit there, so I'm going to see what they want to do. But it's not something that we'd start panicking about.
With little George happy and stable for now, the doctor will have to decide if there's anything more serious than a simple chest infection. Ambulance traffic into Casualty is still heavy. The latest admission is an 81-year-old with an uncontrolled nosebleed.
Spent an hour trying to pinch it, put tissues under it, still not looked to be more concentrated to the right nostril. He's had no sort of head trauma, no headaches, no dizziness. Pulse is 78, blood sugar 13.5.
It's a bit high. It's what? What? Going down your throat? Well, if you can, spit it out into here.
Terry's been bleeding chronically for 2 hours, and neither he or his wife Pam could stop the flow.
Oh, clocks. Okay.
Staff nurse Amy takes over from the paramedic.
Hello, Terry. What happened then?
I thought it would rain. Raining.
Can I answer for him? Of
course you can.
Well, I thought he'd actually cut himself. He hasn't had his medication yet.
What medication is it?
Alzheimer's.
I won't give him any blood thinners at the minute.
Yeah.
I don't want to be a paramedic. I don't want to be first on a scene. I think it's a little bit too traumatic for what I can deal with. So I went and did my nursing instead.
With no previous history of chronic bleeding, the Casualty team need to do blood tests to find an explanation.
Hello, Terence. My name's Sharon. Come for a blood sample if that's okay. Not that you've already parted with the no.
Meanwhile, Nurse Amy is having to give her colleagues an explanation for her injury too.
Don't even start. It's not even from fighting. It's not. I had my tooth implant done. Oh, they're all taking the mickey out of me.
Everybody laughs at me because I go kickboxing for an hour after a hard 12.5-hour shift. A lot of people find it quite surprising. I had my tooth implant done last Monday, and it all swelled and all the bruising like went under my lip and up to my eye.
Painful.
Very.
Oh, bless you.
I've still got my stitches up.
Bless you, man.
Okay.
Bless you.
I can't smile or laugh at anybody.
I'll make you laugh.
Dr. Nathan Gothard picks up Terry's treatment.
Have you ever had nosebleeds before? No. You haven't? Okay. Do you have any other medical conditions?
Yeah, he has dementia, he has diabetes, high blood pressure.
Do you take any anticoagulants, any blood thinners?
Just aspirin.
I think it's likely going to need to probably pack it to cause it to stop dripping blood.
Yeah.
All right. So I'll be back in a minute.
All right then, thank you.
The doctor needs to stop the bleeding fast.
Take that off, have a very quick look.
The procedure can be quite painful.
If we can see a nice spot, we can stop it. Yeah. But if that's been going all morning and still pouring through all this stuff, then we can get you to see the ENT guys, the nose guys, so they can have a proper look with a little camera.
Terry needs to be examined by a specialist consultant.
Your face is a right mess. Your face, it's a right mess.
An endless stream of ambulance arrivals have made this a tough shift for sisters Jane and Benita.
I've had enough to stop queuing.
Some of the patients, though, had their working days cut short hours ago.
There's his shoe.
Builder Anthony has now had his thigh wound reviewed by the orthopaedic surgeon after an injury at work.
What was his thought?
He says they're going to open it up, get it a good clean, make sure there's no further damage, see if they can see any foreign objects, and then take it from there, basically.
He don't think it's ligament damage, he just thinks it's muscle. He'll know more when he opens it up. He's just got to cut it open a little bit more, bigger than what it is anyway, to investigate further.
Perfect, okay, so I will now do another glamorous dressing for the third time today.
After 2 trips to Casualty in the space of 1 week, will it be third time lucky for Anthony?
What I'll be next week for?
Don't come back, will you? With the best will. I'm sure you don't want to come back with another injury.
So he's got jobs to finish there, but it looks like I might have to learn tiling.
Anthony was booked into theatre to be stitched up the next day.
Try that.
Oh, that leg's gone dead now.
The wound wasn't contaminated, but it could be 8 weeks before he gets full mobility back in his leg.
Good stuff. Thank you very much. Okay, you're welcome. No worries. Bye, love.
Nice one, cheers.
Outside Casualty, the queue of ambulances is dwindling, but there are still patients needing to be admitted or discharged. Across in Cubicle 1, Terry's chronic nosebleed has stopped.
They've just put something up his nose and like inflated it and hoping that might stop bleeding, but we're waiting to see ear, nose and throat now to see what needs doing.
Are we having a bit of a clean up? You're looking a bit better.
I don't feel.
Do you want some toast?
Just a bit of toast and then you can have your tablets.
Yeah.
Yeah? Any butter or marmalade on it? Or jam? It's easy to just look at a patient as a patient rather than a human being. I like to know the background of where they're from and what they've been through. How long have you been together?
We've been married 58 years.
How did you meet?
Dancing. We used to go to the same dance place.
Have you got your tap shoes on, Terry? Young love's dream. Well, it's always nice to have a natter with them. It's always nice to have a chat. You find out so much about a person just by having a general conversation with them. Give me a shout if you need help. It's nice to just get out of the professional nursey mindset.
With Terry looking more comfortable, the ear, nose and throat team can start their diagnosis.
Never had any operations to your nose before? No. Any recent infections?
No.
No. Hardly.
Are you allergic to anything?
No.
No.
No animals or pets or no? It's quite scary when you have a nosebleed, when it's really big, because you think, oh, you're losing loads of blood, and it's all right in your face, isn't it?
With no history or recent trauma to explain the bleeding, Dr. Rob Telford will need to look for other causes.
I see you take quite a few medications, and then you're on antiplatelet medication, so ticagrelor and then aspirin as well, is that right?
Yeah.
You're on medications that change your bloods, which means that you're more at risk of it.
Medications for his heart condition appear the most likely cause of Terry's bleeding.
So just have a look in the back of your mouth first. So if you just open your mouth up for me. So it's doing its job. There's nothing obviously bleeding from the left side on there. You're going to have to stay in hospital for at least 24 hours with this pack in, so that we can take it out tomorrow and have a look. Yeah.
Thank you.
Thank you.
Thank you.
Terry stayed in hospital for 5 days and had his nose cauterised. He was transferred to Sheffield for further tests for infection and anemia. Over in paediatrics, toddler George has breathing difficulties.
Oh dear.
Dr. Matt Corkill talks to Mum Charlotte and Dad Nathan, who's just arrived.
Hello. So what's been happening?
Can hear he's struggling to breathe.
And it's terrifying. It is.
I know how it feels.
Do you have asthma as well?
Yeah.
Is it asthma or viral induced wheeze he's been diagnosed with at this point?
He hasn't been diagnosed with it at all.
Okay.
Just eczema and hay fever.
Ah, so he's got the works, hasn't he?
Mm-hmm.
Right then, Mr. Man. Shall I make you feel a little bit better? Can I have a look? Can you lift your t-shirt up for me? Good lad.
With a family history of asthma, Dr. Corkill needs to get to the bottom of George's breathing difficulties.
Oh. Why have you got sausages in your ear? So it's a little bit red in that one, like with having a bit of a viral infection. I need to look in your throat. Can you sit on Mummy's knee, please? Rah!
You
Can
do
you
it.
rah?
Stick your tongue out and go ah.
With signs that George is fighting a virus, his immune system is going to need a little help.
With him having recurrent episodes and with your family history, I might give him a bit of prednisolone. I don't know if you've ever had that before.
What's that?
It's a steroid for his chest. I think he probably is someone who benefit from some of them. We need to just settle it down and then get the steroids to work.
Hiya, is it George? Yes. Hiya George, my name's Greg, I'm one of the nurses. I've heard you're a very big, brave boy. He's got no allergies that we're aware of. You know.
Not that I'm aware of.
Alright, buddy, good boy.
If the steroids don't improve George's condition, he may have to stay in hospital overnight.
I'm so sorry, buddy, we're nearly done.
So make you feel better. It's okay.
Not the best. Last little bit and then we're done.
Tiny
Ready?
bit.
One more, let's get it done.
Yeah.
Good boy. Oh,
You've done it.
well done, well done.
Good boy.
Well done.
Time to see if the steroids and nebulizer have stabilised George's condition.
Hello. Hello, Mr. Man. How are you? Oh, that's loads better. Can I listen at the front, Mr. Man? Is that all right? Good lad. His chest is loads better. If you're happy, he's happy, we're happy for him to go home. One thing I always say is Mummy and Daddy radar. If you're worried in any way, bring him straight back, okay?
With everyone happy that George is out of danger, he's given a short 2-day course of steroids to speed his recovery.
Can we go home?
You can go home. But you need to tell Mummy if you don't feel well again, okay?
No.
No worries, see you later.
See you later. Cheers.
We're home.
Yes.
And with the ambulance bay finally cleared too, George isn't the only one leaving for the day.
I think sometimes when you've had a really bad shift, you go home and you think to yourself, I've got it all again to do tomorrow, but you mend your aching bones and your tired hands and feet, and you're either an A&E nurse or you're not an A&E nurse.
See you tomorrow.
And a new team will be keeping Barnsley Casualty running 24/7.
Life still beating in these crumbling walls. Tonight we sing where nobody sees. In the junkyard we are free. Underneath the moon silver haze, we'll embrace these throwaway days. Lost souls and cobbled parts create art with our mended hearts. Every scratch has a story to tell in this haven of heaven and hell. Old guitars strum a haunting tune underneath the pale forgotten moon. Oil-stained fingers dance in grace, finding rhythm in a discarded place. Tonight we sing where nobody sees. In the junkyard we are free.